Good evening, everyone. Thanks for coming this evening. We got a little late start, but it was good because people have arrived late. I want to introduce myself. I'm Melissa Sweeney. I'm the Community Liaison on Providence St. John's Phase 2 Master Plan. It's a long title. And I will be the MC, if you will, for tonight's presentation. Tonight we're going to be making a presentation on the Phase 2 Master Plan, and the purpose of the meeting is fourfold. First, we will give a brief history of St. John's Health Center. Second, a summary of the development agreement with the city and the DA amendment, which govern the campus. Third, we will be describing what is planned for for Phase 2. And finally, we will be taking your questions and comments at the end of the presentation. I want to show you these. If you wish to speak at the end of the presentation, we're going to have a Q&A. And in order to be heard, we request that you fill out a comment card, a speaker card, and get it to me or one of my staff people so that I can call your name in order. And then we can have a sort of orderly, thoughtful Q&A process. If you're more interested in providing us a written comment, these are also up at the sign-in desk. And they are written comment sheets, and we collect those, and we provide copies of all of these documents to the city. So that is where we are with that. I'd like to introduce our presentation team this evening. Mr. Marcel Lowe, who is the Chief Executive of Providence St. John's Health Center and John Wayne Cancer Institute. Ken Lee, with Perkins Eastman Planners and Architects, an international firm with an emphasis on healthcare. Lindsay Barker, who is this is the longest title in the world, the Community Ombudsperson for Providence St. John's Health Center, and Mr. James Mary O'Connor of Moore Rubel Udell Architects here in Santa Monica. So we will be looking at the Phase 2 Master Plan. We'll be concentrating on the South Campus, and we won't be discussing in this presentation individual buildings because this is a conceptual plan. But at the point of the Q&A, please feel free to ask questions about individual buildings, the location or function thereof. So without further delay, I'd like to introduce Lindsay Barker. Marcel Lowe, I'm sorry. We've been doing this without Marcel for so long. Here you go.
Thank you. Good evening, everybody. Thanks for coming. I was fortunate enough to join St. John's last September, so I've been here about 10 months. And many of you know that St. John's became part of the Providence system a year ago last March. And, Providence was very pleased to have St. John's join the family. And I want to talk a little bit about Providence so that you understand that. But just a little bit about St. John's, and I know Lindsay's going to talk a little bit more about the history of St. John's. But just to kind of remind you, St. John's is a not-for-profit healthcare system within Santa Monica in this region, which means that we have a real focus on serving the community. We are a community hospital. And that's part of what we want to do within our community. So Lindsay will talk more about that. But I wanted to back up. How did I change that? Did I change that? I don't know. I'm magic fingers here. Yeah. So a little bit about Providence. And I wanted to talk a little bit about, obviously, when the sponsorship transitioned from the Sisters of Charity of Leavenworth to Providence, we were very pleased to continue the Catholic heritage of St. John's. And as you can see on the screen here, our mission at Providence is we reveal God's love for all, especially the poor and vulnerable, through our compassionate care. So I think the key there is that we recognize that we serve all kinds of people within our community. But we also need to have a special focus on the poor and vulnerable within our community. And that's really something that we continue to focus on. Our vision, together we answer the call. Will you quit doing that? We answer the call of every person we serve, know me, care for me, ease my way. And that's a really strong statement from the standpoint of really what we want to do as a vision for Providence. And it's really something that we really focus on every day at Providence. So now you can switch to the next slide, Lindsay. So Providence is a health system that's pretty much located on the west coast of the United States. We're in 5 states: Alaska, Montana, Oregon, Washington, and California. And we have 34, they're hospitals, but we refer to them as ministries. And so St. John is one of the 34 ministries within the 5 states there. In Southern California, we have 6 hospitals, 6 ministries within the Southern California market. And St. John's, we were very pleased to have St. John's as an addition to the Providence system, because we're located kind of central within the Southern California region of Providence. So we're the hospital on the west side here. And obviously there's a lot of focus, but we do really focus on major service lines within Providence in cancer, imaging, cardiology, neuroscience, and sports medicine. And the added bonus for us here at St. John's is that we have the John Wayne Cancer Institute, which not only really helps us with our clinical programs, but is really one of the leaders in the country on research. So that's really a focus that we have from that standpoint. And then the map just kind of gives you an idea where our locations are across the Southern California region. So with that, I'm going to turn it over to Lindsay. You want me to do the clicker?
I'm afraid now. Hi, everyone. I'm Lindsay Barker. I'm the Community Ombudsperson, and I've been with the Health Center for about 5 years. So I'm just going to quickly go through the history of St. John's and our development agreement with the City of Santa Monica. So St. John's was founded in 1942 by the Sisters of Charity of Leavenworth. It's always been a nonprofit Catholic hospital. And as Santa Monica grew, so did St. John's. It reached its peak size in 1994 with 662,000 square feet and 501 licensed beds. So that's when it was at its biggest. But then, of course, in 1994, we had the Northridge earthquake, where the hospital suffered significant damage. We had to fully evacuate the hospital and close the hospital temporarily for 9 months in order to make temporary seismic repairs. So at that time, we also wanted to start planning for the new state seismic requirements that were going in place, and how can we rebuild the hospital to meet those, as well as plan to become a leader in healthcare for the 21st century. So we implemented a development agreement. It was approved in 1998 after a 30-month planning period, and it is divided into 2 different phases. Phase 1 was to rebuild the core hospital facilities, consisting of the inpatient suites and the diagnostic and treatment center. In 2011, we had a development agreement amendment that ensured that St. John's would meet its peak parking demand through owned and leased spaces instead of building a parking garage underneath the entry plaza. The development agreement also augmented different community benefits and put in place community benefits, such as the Transportation Demand Management Plan and different contributions to infrastructure, like the Expo line. Okay, next one. Okay, but we're really here to talk about Phase 2 tonight. I won't bore you with history. So Phase 2 really focuses on what kind of health and wellness programs should St. John's be building for the future. So all of the properties for Phase 2 are all outlined in red. There are different requirements for each side of the campus. For the North Campus, there are certain vested floor areas and heights. And for the South Campus, we have to submit a South Campus master plan. There has to be 35% open space. And there's a vested maximum floor area of 396,500 square feet. But for Phase 2, in total, there are vested uses. And again, the development agreement really emphasizes different programs like health and wellness, outpatient and ambulatory care, medical research, for example, our John Wayne Cancer Institute, and daycare services. Many people don't know that community benefits and childcare are part of our development agreement. So the development agreement actually formalized our community benefits in 1998. It has a community access plan that we report what services go directly to Santa Monica residents and nonprofit agencies. So in 2014, the community benefits just to Santa Monica residents and nonprofits was valued at approximately $5.87 million. That includes contributions for medical and mental health services, as well as grants to local nonprofit agencies like WISE, OPCC, Venice Family and Health Clinic. We also have a DA requirement to provide daycare for our employees. So we provide daycare for infants up to preschoolers. We also provide subsidies for income qualifying families. And our Child and Family Development Center also has a therapeutic preschool that's part of another mental health program that CFDC provides. So I've talked enough about programs. I'll toss it to Ken Lee, who will go, okay, I'll keep leaning. I'll give it to Ken Lee, who will talk more about the different programs incorporated into Phase 2.
Thank you, Lindsay. Before I get into some of these permitted uses, let me just describe perhaps the team composition of our planning team. Both James and I represent two local architectural firms with a particular expertise in healthcare planning and design, as well as urban planning and campus planning. But we also had a number of other consultants as part of our team to look at a number of issues beyond the campus and beyond the program. They're here today. We have consultants representing parking in terms of Bernard. Just raise your hand. Traffic and street circulation, Dave Schender. Landscape, we have Catherine, Mary, and Pamela. And then Bureau Happold represents our mechanical, electrical plumbing, and sustainability consultant. We have Heidi and we have Chris. So they're available to answer questions during a Q&A or to meet with you after the presentation to talk about some of those particular issues. So again, we tried to look at this planning process holistically. It wasn't just campus specific to the St. John's Health Center. We looked at this plan urbanistically as well. As Lindsay mentioned, the development agreement does call out for a number of permitted uses. These are some of the major ones listed here, and they represent a variety of healthcare and community-based services. So for example, hospital and healthcare, it's the traditional services in a hospital, so expansion of diagnostic services or support services, but also ambulatory surgery, skilled nursing, other services that are complementary to a healthcare facility. In terms of medical research, this is medical research involving labs, both dry and wet laboratories, clinical space, as well as support space to support the activities of a research lab. Lindsay mentioned health and wellness. The development agreement and St. John's Health Center way back in 1998 were very astute in anticipating that over time there'd be more emphasis on health prevention, education, and wellness-oriented programs. So much of the language in the development agreement is focusing on programs that support community health. I'll skip parking for a second. Child and family development, again, the development agreement allows for expansion of both daycare and behavioral health and counseling for children through adolescence. It's part of the community's mission of the health center. Education and conference facilities, again, in support of the health center. A lot of those programs are lacking right now, but it includes things like classrooms, auditorium space, multimedia space to support both health education as well as medical research and patient care activities. Health-related services and commercial activities are, again, services that are related to health care. So pharmacies, durable medical goods, optometry, and those kinds of programs. And then housing. The DA actually allows for a variety of different kinds of housing, including visitor housing, assisted living, long-term care housing, as well as a requirement to replace an existing multifamily housing on the campus. Parking runs throughout all of these uses because with every use there becomes a parking demand, and so parking is embedded in all of the activities that we studied. We started planning about a year ago, shortly after Providence Health and Services became the sponsor for St. John's Health Center here in Santa Monica. We started a year-long planning process that was very inclusive of physicians, leadership of both the hospital as well as Providence Health and Services, board members, and other staff of the hospital. It was very inclusive. In fact, this diagram here, this photo, illustrates a planning short that we had back in July of last year involving those stakeholders with an attempt to try to begin to establish the long-term vision of the health center. It wasn't just about hospital-specific activities. It was about the long-term, broadest mission statement for the health center. We had, as part of our planning process, oversight by two separate committees. There was a steering committee and a working group. We met on a monthly basis, if not more, on a more regular basis. We also had a community open house back in November of last year. These photographs here in this room, we had a community open house to begin the dialogue with the community and residents and business leaders to try to begin to solicit information, input, comments about the overall direction of the Phase 2 master plan. The health center does an annual community health needs assessment as well. And then finally, we have been very active with community outreach, meeting with neighborhood councils, business leaders, and HOA groups in and around the campus itself. And that'll be ongoing through the next 6 or 9 months. So the input that we received over the past 12 months has led to a definition of the program requirements for Phase 2 and the expectations for Phase 2. There are two replacement facilities that are very high priority projects. One is the John Wayne Cancer Institute, which is directly across the street from the health center. It was established in 1981, became affiliated with St. John's Health Center in 1991. It's a very prestigious organization. In the past 2 years alone, I think they published 125 scholarly research papers in both scientific and medical journals. So there's a lot of ongoing medical research that applies to oncology and now broadening the base beyond cancer research. The Child and Family Development Center, as Lindsay pointed out, is an existing program on 20th, just north of Santa Monica Boulevard. It, just like the John Wayne Cancer Institute, is in a facility that is somewhat dated and not really designed for those activities. And so that's one of the primary replacement projects in one of the earlier phases. Marcel talked about ambulatory care services. These are outpatient services that currently exist on the campus, either at the health center or in adjoining medical office buildings. The attempt is to organize them, consolidate them, and make them more efficient from a standpoint of both staff use as well as patient and local community use. Education Conference Center is a facility that is planned for Phase 2. This is a project that will include not just facilities for the hospital staff and the hospital stakeholders, but also be open to community residents on an as-needed basis. And then two types of housing are proposed for the South Campus Master Plan. One is for visitor housing. So there's a 30-bed short-term accommodation for families of patients, visiting scholars, visiting physicians, but again, short-term basis only. And then a 10-bed replacement housing, which currently exists, and that'll be also developed on the South Campus. And then finally, health and wellness is a program and an initiative that permeates throughout all the buildings as well as the campus. So there are facilities for rehabilitation, for fitness programs. There'll be external activities on the site that promote health and wellness as well. So these program goals then led to some campus goals, which preceded some of the physical planning of the buildings and the development. As I mentioned before, the campus-specific plan was not just for hospital-owned property. We tried to look at this planning process urbanistically, look at other external factors that we could either influence in a positive way or would impact the future development of St. John's Health Center. There is a very high priority to promote sustainability, both in buildings, in systems, as well as in health and wellness. There was, and still is, a goal and an objective to satisfy all current and future parking on campus. Most of this will be below grade that James will describe in a few minutes. And then finally, there again was a goal to look at urbanistically all the factors that affect circulation on and around the site. So vehicular traffic, pedestrian activities, bicycles, trying to create a campus and a neighborhood edge that would become a lot more active and more friendly to residents in the community. So with these both program goals and campus goals, we began the physical planning of the site itself, which I'll turn over to James.
Good evening. So I'm James Mayor O'Connor with Moore Dell. We're a Santa Monica firm, and we're always delighted to have the community meeting here because it's a building we designed. The Santa Monica Library is one of ours, and we're here also with Pamela and her group who designed the landscape. So that's always terrific for us to and see how the building is working. Looking at, and I'm going to take you quickly through the master plan and kind of in a broad way, and we can have questions afterwards. But the first thing we're looking at is the overall context. And so we're pulled out quite a bit here. This is sort of site context and transportational.
Turn on the mic.
Okay. Can you hear me now? Okay, great. Okay. Okay. What we're seeing here is the amount of time it takes from the campus, Providence St. John, to walk. And we're very fortunate to have the light rail coming in. We have 2 new stations, 17th and 26th, and it's within 7 to 10 minutes walking distance. Providence is going to, St. John's going to either operate or be part of a shuttle that will take you from the stations right to the campus itself. But we want to really promote public transportation, bicycling and walking. The city has also approved bike share stations, and they'll also be part of this. We also are integrating the existing bikeways that are bike paths that are around the campus as part of this. Next. This is going in a little closer, what we're calling the neighborhood grid. And you can just see the Santa Monica Boulevard here, 20th Street here, and 23rd here, the existing block here. When Santa Monica was laid out, it was a pattern of residential streets from the beach back, and they tended to be 300 feet east-west and north-south 600, 300 by 600. And what's happened over time is that pattern has gotten bigger. And not only at Providence St. John, the hospital here, but in other places. You can just see the pattern above, which is every 300 feet there's a road. And the smaller the grain, the smaller that dimension is, the better the place. So the 300 feet is much better than 600 or 1,000 feet. One of the best cities in the United States is Portland, Oregon. The city of Portland has 200 feet by 200. And of course, one of the worst places is Beijing, which is 1,600 feet. But we're not going there. So the idea here is to introduce, within our site, is to introduce 2 new streets. And the great thing about introducing more streets and breaking down the pattern is it alleviates the traffic. It improves. It's like, I describe it like opening up the arteries. It's giving more areas to move. So we're looking at providing 2 new streets within the site itself, 20th Place and 22nd Street. This will alleviate traffic and congestion on Santa Monica Boulevard and Broadway. And the circulation is almost a loop system. We're looking at the existing 21st Street, opening that, making it a very pedestrian area in a start, and having a very simple road through the rest of it here. Next.
Why are you closing off traffic on 21st Street? Will improve circulation?
The circulation will be, and we can get this more, the circulation will be here. We'll still have fire access here, but we want to look at making this more pedestrian, and basically the 2 streets will protect the middle. All the services, all the parking will be on both sides of this street, and it'll create more of an open space here for people to use. Let me take you through it, and you'll see that. Next. We also are looking at integrating both the north side of Santa Monica and Phase 2 together with landscape and open space. And the idea of a wellness walk. The red line that you see here is a kind of walkway that's going to integrate both sides through open space, therapeutic elements, and wellness stations and activities all along there, and creating a very kind of vibrant space here as a counterpoint to the existing, complementing the existing Mullen Plaza. Next. Now, where do buildings naturally belong? This isn't a mixed-use project. This is a different kind of mixed-use project. It's a community hospital, but certain functional things have to happen. And when we look at the functional zoning, the acute level really means right beside the hospital. We have the ambulatory care and research, which needs to be close, and other uses, more residential or child and family development, can be more towards the residential Broadway. That's just a kind of zoning where things normally should fall. Next. So we looked at where buildings would happen. As I said, acute buildings closer to the hospital, research, and the John Wayne Cancer nearby, but close by. The conference center and education center can be here. The multifamily housing and the visitors housing close to the residential, and also child and family development center can be down there. We're also looking at a parking structure on 20th Street. We're going to have parking below all the buildings, but we're also looking at getting some earlier parking on 20th Street. That's the existing site that we have, the Child and Family Development Center. It's a good site for a parking structure. It's an infill site and could get early parking there. Next. Now what you're seeing is an aerial view of how the open space and the buildings connect together, creating an outdoor space here that is very activated, which uses the educational center here and the research buildings around. We're also looking at connecting it across to the existing hospital on above grade here on both sides, and also the housing as we see it slipping down here towards Broadway. Next. Now, when we look below this, I mentioned we're having parking below all the buildings. You can see the two roads that we're talking about on both sides, east and west. Each one will have its own entrance. Right now, at the existing St. John's, it's like the Los Angeles airport, Tom Bradley. Everything is going into one entrance, and there's massive shuttling around here. We want to change that dramatically. We are putting on entrances and exits throughout. We'll have multiple ways in on every level. We'll have connected below. We'll have the parking structure here. And with our consultants, we have estimated that we have enough, when this is fully built out, parking for the entire campus and also for its peak time, all on site, without any shuttling from anything off site. Everything would be handled within its site itself. Okay. And what we'd like to do is take you on the implementation plan, and that's translated. That's like the phasing plan. Lindsay and myself will build the model. This is our site model.
So first, let me kind of talk about the staging while you get set up. So we estimate that this will take approximately 20 to 25 years from the time of the City Council approval to when the very final building is constructed. It's a long-range plan. We can't do this overnight, and in that time estimate, it accounts for design review, fundraising. We're a nonprofit hospital. We rely heavily on charitable donations for construction projects like this, obtaining all of the building permits, and then the actual construction of the different buildings. So we have some key priorities as we determine the staging and when things would go into place. Number one, we want to make sure that St. John stays open the entire time and that all of our services are fully functional throughout the construction period. We also want to make sure that we minimize the impact on our caregivers, but also our community members and the residents in the neighborhood. We also know, and Ken talked a little bit about this, that we are prioritizing our John Wayne Cancer Institute and our Child and Family Development Center in the staging process. The John Wayne Cancer Institute is in a building that doesn't have the infrastructure it needs to make sure that it can adopt the rapidly changing technology in cancer research. We want to make sure it lives in a building that can handle that. And also our Child and Family Development Center, we want to make sure that we continue to provide daycare services and mental health services to our employees in the community throughout the construction phase, and also anticipate any increase in demand for childcare. The other thing is we want to make sure we can provide parking throughout the entire stages, make sure we meet our current parking demand as well as any future parking demand. And so in order to complete that 20 to 25 year span, we will have to go for a development agreement amendment to make sure that we can do it in this way. So we're going to use the model to illustrate what goes when. It's kind of a puzzle.
Over 25 years. And what we're showing here is the existing, what's on the site at the moment. That's the existing health center, the two sites on both sides, east and west, the South Campus Master Plan, Geneva Plaza. This is Santa Monica Boulevard, Broadway, and 20th Street here. This is 21st Street right there. That's that MRI building. And the John Wayne Cancer Institute is at the moment in this area. And this is the parking lots that exist here right now. That's the Shader condominium project right there, or housing project.
And one other piece, I know there's some hesitation in the front, as you can see the letters kind of are all over the place, right? We want to make sure that construction spread geographically, so not one particular area has concentrated construction throughout that entire period. So one letter isn't 25 years. That's just how the entire time span of the entire project. Okay. So our first step in this process is demolishing a temporary MRI structure that borders Santa Monica Boulevard.
And eliminating the parking?
Yes. So the first shovel for new construction is to build a subterranean parking garage for that entire space. Okay, the next step, that's A, letter A.
That's A. Yes.
Okay, so that all of letter A, subterranean parking first. The next step is we will construct or get rid of the parking at John Wayne Cancer Institute.
And because this building is much smaller, this is a small building, this will be one of the first ones.
Correct. So this is the replacement 10-unit apartment building. Currently, there is a 10-unit apartment building on 21st Street that's been vacant for a number of years. So we will replace that building along Broadway. Next, we will build the West Ambulatory Care and Research Building that will house the John Wayne Cancer Institute and outpatient services. In that building, there will be clinical research and outpatient services related to cancer, neuroscience, chemotherapy infusion, things of that nature. No. Good question. Ambulatory care does not mean ambulances. It's actually kind of the opposite. It's those regular doctor's appointments that you have. All of our ambulance traffic will still go to the emergency department entrance. Yes. Good question. The next building is our Child and Family Development Center. This has our daycare program, as well as our outpatient mental health and behavioral health services for children and families.
And that allows us to...
and one last thing, James, easy, is we will be building the 20th Place Street to connect Santa Monica Boulevard and Broadway, and that allows entrances to the subterranean parking for all of Stage A. There also is a small road that will connect Broadway to the 10-unit apartment building. That will be the new 22nd Street. So just a small piece so people can get to their parking. Okay. The next stage is B. Hold on, and we'll get to that. I don't have the number in front of me. So for stage B, we'll demolish, once all of the kiddos go to Child and Family Development Center and they're relocated, we'll demolish the existing CFDC building. In its place will go the North Campus parking structure, which has subterranean and above grade parking, and an activated ground level, which we designed for bike parking and bike use. Okay. After that, we'll demolish the existing John Wayne Cancer Institute and the vacant 10-unit apartment complex. In the meantime, before anything is built on that site, it will be used for surface parking as well as construction staging. Next, in Area C, we'll be building the Education and Conference Center. This is designed as an auditorium, a place with conference rooms and education labs. It's really designed for community use, so community organizations could come in and provide education seminars and that type of thing as well. Also included in C is the East Ambulatory Care and Research Building. This is designed for physical therapy, sports medicine, and that type of use. And then also along Broadway is the visitor housing for patient family members so that they can stay while their loved one's in the hospital or visiting researchers and clinicians. Okay, and then D, now we move on north of Santa Monica Boulevard, and again, long-range planning. So north of Santa Monica Boulevard, we'll remove the west parking lot adjacent to the Mullen Entry Plaza. In its place will go the West Ambulatory Care Building. This building would have cardiovascular services and things that need to be, again, closer to the hospital. At this time, we'll also build a pedestrian bridge that connects both of the West Ambulatory Care Buildings, designed to make sure that we get patients who need to go from appointment to appointment can do so without having to go on the street or be transported by vehicle. And then finally, we'll demolish the building on 23rd in Santa Monica and the surface parking lot there. In its place will go the East Ambulatory and Acute Care Building. And this building, again, is designed for more hospital functions, pediatrics, women's health, and those kinds of services. So again, the way that we designed this was to try to spread it out. We know this isn't going to happen overnight, and it's really trying to think long term. What kind of services should we anticipate to, we want to make sure that we're providing for the entire community in a long-term fashion. And with that, I think I will turn it back to Melissa.
Thank you. That was very interesting. So this, as Lindsay said, is a very long-term process, our long-term planning process. It's also a long approval process, and as you can see, we are here at the community meeting stage, and we have community outreach ongoing. We'll be meeting with neighborhood associations, with individuals, with nonprofits with whom we have relationships, and nonprofits with whom we don't have relationships yet. We'll also be going to Planning Commission float-up hearings, City Council float-up hearings, and these are all opportunities for the public to provide feedback or input, whichever term you prefer. The CEQA and EIR process is another opportunity to weigh in on environmental concerns that will be studied. The draft EIR will be released, and that public comment period will then commence. The final EIR will be released, and then we'll go into City Council final hearings. This is as you see, many, many months long process, and it's a process that we invite the community to be involved in. That's one of the wonderful things about living in Santa Monica is there's so much emphasis on community and process, and we are ready for that long process. So with that, I want to thank you for sitting through our wonderful presentation. And this is how you get in touch with me. I'm at psjplan@gmail.com or that number. We also have a website that we're going to be updating regularly with this slideshow, with this presentation. It will be available to be streamed from the website. And with that, we also have cards up in the front there if you wish to take a card that has our contact information. I'd like to open up the discussion to the Q&A. If we could have lights.
Yes, this is a view. You can see the hospital. It's actually what we're calling the St. John's Square, and you can just see the hospital right here with the cruciform and the open space we were talking about. Yes. Yes.
Okay, so if you wish to speak, it would be really helpful for us in terms of our process staying efficient and being thoughtful. If you fill out one of these forms, if you wish to ask a question, I will call out your names, and then one of our team members will provide a microphone to you. And if you could keep your remarks as concise as possible so everyone gets a chance to speak. I'm just looking for my staffer. There he is. This will be our Oprah Winfrey mic. This is Zachary. The first speaker card I have is Juan Matute.
Juan, come to me. I'll come to you. Thank you for the presentation. I had to join a little late. I wasn't able to get off work till about 6:30 today. I live in the area, 26th Street in Santa Monica. I walk through the area a lot, so I'm glad to see that some of those corridors will start to open up between 20th and 26th. There's really not a lot of ways to get through right now between Colorado and Broadway, so I'm glad to see in this plan that it sounds like 21st will open up, and some of these others will open up. I think this is great. I think this is a needed project for the community. You know, we think on a national level, we've had healthcare reform and more people having access to healthcare, which brings more people into the system. So it makes sense that we would have to expand our hospitals locally in order to provide more people with healthcare who haven't been able to access it before. So I think this is a great needed project that brings benefits to this community, but also other communities that haven't previously had access to healthcare. You know, living in the neighborhood and already having a lot of traffic on the occasions that I'm pulling out of my driveway and waiting for all the cars to go past on 26. You know, I heard a lot of talk about parking. I would want to make sure there wasn't too much parking so as to, bring more people in who would ordinarily not maybe drive into the site, because I know that, a vehicle trip requires a parking space, and all of those cars that are going through here will end up in those parking spaces. So, I heard about peak parking and other things, but I want to make sure there's not too much parking so that brings even more cars out on the streets.
Thank you, Juan. I have a request to speak from Nancy Morse.
Nancy?
Raise your hand, Nancy. Oh, there you are.
Right here.
Hi, Nancy.
My question is about parking. It's making it, in you're talking about the underground parking, it sounds as though you're putting in a lot of parking, but I notice all the signs say reduced parking. And those of us who went through the first phase and the shenanigans to reduce the parking. I understand the concern for overparking, but I am also concerned that there's not enough parking. My other concern is in phase one, it was rather disruptive and inconsiderate to the neighbors. And so my concern is that the manner that this be done, be aware there are residents, and you know, when you block their driveways, it's not fun. Thank you.
Thank you, Nancy. I have a request to speak from our mayor, Kevin McCune. Thanks for coming, Kevin.
Well, thank you, and I'm glad to get to see this along with members of the public. I have a few questions. The first is for Lindsay, and Lindsay, you talked about providing daycare. Please assure me that what you meant was early education and childcare.
Absolutely.
Okay, that's important to us.
In the DA, it specifies daycare, but it's early.
We have learned since then. And as long as you talk about the DA, let me ask, I wasn't yet on the council when that was passed in 1998, but I thought it was a 20-year development agreement.
So for this period, it ended, I believe it was July of this year, correct? Paul, I'm looking at you. Sorry.
Let me get to the
I don't
point.
want to, yeah, go ahead.
I heard a groan from the front of the room.
Okay.
You said 20 or 25 years. So how much of an extension does that represent time-wise of the original DA?
So I'll let Paula answer this question.
Oh, she's calling on her attorney.
I don't have everything memorized. For some reason, Paula seems to.
The nuance with the time to build out is that per the development agreement, it says they have 18 months from approval of a particular building to obtain a building permit. And so that would mean, assuming the city wants to approve everything together in one package, that St. John's would have 18 months to build everything here. And I don't think that would serve anyone in this community, and St. John's definitely doesn't think it would serve their needs to build it out within 18 months. And so that's the extension request, is to allow more time to obtain a building permit for each building.
But you're jumping from 18 months to 25 years. That's a big jump.
It's up to the city's discretion.
I know
so,
that.
Yeah.
That's why I'm asking.
So, I mean, we're being very conservative in the time frame, and we want to make sure that we do this right. There were challenges with phase one, and so...
Okay, two more questions. You talked about the replacement housing of 10 units. What is the anticipated affordability on that?
2 units will be affordable at the minimum.
Well, that's not much. That's barely above our affordable housing production plan. You said that there are 10 units there that have been vacant. For how long have they been vacant?
Since before the 1994 earthquake.
And does St. John's own that property?
Correct.
Was it seismically damaged? Is that why it's remained vacant?
I don't know.
So,
the
I
answer
mean,
to
has
that
St.
question.
John's kept 10 units of housing off the market in our very difficult housing
Correct.
market?
It's empty.
That's an interesting policy to have had. Okay. My last question has to do with how much styrofoam I see up there. As I remember, there were some height entitlements in the DA passed by that previous council that go beyond what the land use and circulation element we adopted 5 years ago allows. Do you anticipate asking for a land use and circulation element exemption as well as a DA extension?
The land use and circulation element actually specifically references St. John's development agreement. So
So can you give
it's
me-
not required to ask for a land use and circulation element.
So how high are
amendment.
those buildings?
Do we have that slide that shows the North Campus, the heights? Just the one in the presentation that showed the maximum heights under development agreement?
Well,
I think, no, that one. No. Yeah, it's the one that Lindsay.
I think the original DA talked about something like 90 feet or more, 90 or 100
I know
feet.
it has the height.
And that would be well
Slide
above what the
6,
current
yeah.
lease allows.
So this shows it's a maximum of 70 feet on this site on 20th Street, 95 feet next to the entry plaza to the west, and 75 feet to the east.
Okay, so it's your position that the loose doesn't preclude going to 95 feet because you say it was referenced.
It was
in the
referenced
loose.
and the development agreement was approved and the vested rights run prior to the loose being adopted, but also the loose did incorporate mentions the development agreement and the rights of St. John.
But of course, that, as you say, is negotiable with the city because you're asking for a substantial amendment to the existing.
There is an amendment, and I'm sure there'll be many negotiations, yes.
Thanks.
Yes, that's
It's actually 5 floors.
5 floors for area 2C? Or C?
Depends on how big you
oh, they're
So yeah, 5 floors for the building labeled 2D, 2E, 6 floors, 2C, and then for, I don't know if that's 2I, it's 6 floors.
Okay, we have a request to speak from Elizabeth. Raise your hand and we'll get a microphone. Hi, Elizabeth.
I just wanted to ask, we've got one bridge over Santa Monica. Is there a reason why we're not doing two? I mean, there's a lot of pedestrian traffic. Why we don't have one on like 24th or 23rd or somewhere that side as well?
Well, we felt, Santa Monica is actually building a huge number of bridges right now. It's unprecedented with the light rail coming in. But here we wanted to build a different kind of bridge. We want to build a very light and glassy and open bridge, and mainly to take, traffic, people are quite sick here coming across. We didn't build a second bridge because we feel that with this one bridge that we could we'll run it. I mean, we'd love to have 2 bridges, but we feel that that would be very expensive to do. We have a number of bridges already. This building here and this one here would also connect with bridges back.
Where are they going into the current building? They're up, I guess.
Yes, this is actually
what floors?
So this is like the 3rd floor. Normally a bridge, like say the Expo line coming in, most freeways are up about 15 feet high. This would be more like 30 feet. So it would be up quite high and creates, and that's the height we need to connect with the existing hospital.
And to connect to the existing hospital is 3rd floor?
Yeah, 3rd floor. Yeah, that's the only, because the site slopes up here. The 3rd floor is the best place to connect with the existing atrium and space here and connect it across.
Thank you very much. There is someone with several questions. Bethany Proctor. There she is.
Hi, I'm going to actually come up to the front so you guys don't have to turn around. So I'm just going to give some info about me because I actually was born in '94, 2 weeks before the Northridge earthquake. And I just wanted to say that back then the hospital responded so professionally. So when this is completed, that will be really exciting to have that professional staff. And back then they actually saved all the babies and I was one of them. So that was really amazing that they could do that in such a big earthquake. Most importantly, the hospital functioned as a community. So my questions have to do with the health center. Do you know how many new jobs will be created when phase 2 is complete?
We've done, Marcel, you want to take that one?
So from the standpoint of what we are developing here, we don't have the specifics yet of what those new jobs would be, but we know that with the expanded programs that you saw tonight, that there will be an expansion of employment opportunities based upon the service lines that we develop. But we don't have the exact number right now.
Okay. Yeah. We have done some modeling when we were looking at the new daycare center to anticipate what the expansion would need to be for new employees and things like that. We did take a brief look at it. Also for parking and to make sure we have estimates that are accurate.
Okay. My second question, I'm a designer, so I look at the South Campus from a designer's point of view. I just wanted to say that I see that the plan is very organic as opposed to boxy and rigid. So my question is, are organic looking plans as efficient as boxy ones, especially when it comes to healthcare uses?
I think you can have both. You know, the human body is quite efficient, but we're not a straight box. So I think it's nice to, and especially with, you know, when you look at the existing building, it's a lot of curves. And hospitals today often are boxes, like you said, but I think you can do both. The efficiency is within the building, but the circulation is one of those things that actually can be quite fluid. So the circulation is on the outside, and that's what can have the curves and break down that sort of rigid feel to it.
And if I could add, James is correct. We try to create some fluidity in the plans themselves, but because we have some very technology-driven functions of outpatient services, clinics, and research activities, the interior planning has been very carefully thought out, so it is as efficient as we can make it while still creating a sense of architecture on the campus that is dynamic and shows movement.
Okay. Thank you, guys.
Thank you, Bethany. Our next speaker is Dr. Daniel Columba. Is that how?
Yeah, you referenced the development agreements that was done in '98 and the amendment of it. What are you looking for beyond what has already been approved in the development agreement and the amendment?
So what we're looking for beyond
what's already been approved.
I don't know if I understand your question, but
I could read the proposed amendment to you. We're not asking for any more height, any more floor area. We're asking to give the Planning Commission and City Council discretion to approve more than 18 months to build out each of the buildings. That's it. It's one page. Happy to share that with you.
Quick question about 21st Street. 21st Street. The objective of adding the two new streets is to improve the traffic circulation.
Correct.
But you're taking away the traffic circulation on 21st Street. What's the reasoning behind that?
So the idea there is to create an open space here, an activated open space for people, the whole community. And this part of Santa Monica doesn't have a lot of open space. It's not like the beach. So it creates an open space here and makes it a place that everybody can use, very activated. It still allows access through here. But the two roads that are one on each side of that protects the middle. That allows you then to have an area here that's pedestrian, community-orientated, wellness and all of that, while still having your circulation on both sides.
Okay, but you're on 21st Street, the only access there is along Broadway for the existing housing that's there.
Right.
Yeah, they will have their own access, and right now it's quite difficult for them. We've been meeting. They'll have their own access, and they can easily come around here. They will not be coming through here in the future. That's fire access, but they'll have their own almost private access there in a certain way.
Okay, but what I'm saying is that the only way they can get in and out is off of Broadway, and Broadway is a very small little street,
right,
which is heavily congested as it is already with bumper-to-bumper traffic during rush hour.
Yeah, we'll be.
So you're limiting their access and decreasing their access beyond what they have already.
well, currently 21st Street is one way. They can only get access to their parking through Santa Monica.
Yes.
So we're trying to, since that residence mostly has elderly individuals who don't drive a lot. We met with them, and so they liked the feedback we got from their association was that they liked the idea of having a private street. We're really trying to engage all of those different neighbor groups and the HOA of the condo buildings nearby and get feedback from them so we can make it as convenient as possible. We didn't put any parking entrances along that street to really minimize the traffic along 21st.
Yeah, it's a much quieter street here for those.
We've tried to be very careful. Well, let me explain. We try to be very careful in the circulation of vehicles on the campus. We have Dave Schender, which I'm going to invite up to the front. Because I understand. No, he will explain all the street circulation it's a very logical and thoughtful approach, and I'll let Dave explain that to you.
Yes, David Schender with Lynn Scott along Greenspan. Oh, we have a pointer.
Right. We still want you to access we want you to access the building. He'll explain it in detail.
Okay, so today 21st Street runs from Santa Monica Boulevard. It's one way in a southbound direction, intersects Broadway. So today, if you live in Geneva Plaza, to get to your house, you have to use Santa Monica Boulevard. And then once you leave Geneva Plaza, you have to exit out to Broadway. Under the new circulation plan, we believe we provide many benefits to the Geneva Plaza residents in that they now have a lot more options in terms of how they can circulate. They can, because we also have this cross-connector road, they come up Broadway, and they can get to their residence here, and then leaving, they can come to our new 20th place, and they can either go northbound or they can go southbound. And there will be a new traffic signal at the intersection of Broadway and 20th place. So we believe we give those residents, in addition to now having almost their own little private street, basically a better quality of life as compared to the current condition.
Okay, but will it be two-way or one-way on 21st Street?
One way going northbound.
Yeah, and it's only halfway through, and the only real access to that is off of Broadway.
Well, today, the only way to get to there is off of Santa Monica.
Yeah, I know, but Santa Monica is a much bigger street than Broadway. Broadway's a small little street that's already gridlocked as it is already.
Well, Santa Monica is also a very busy street, and we thought that having access from Broadway and the feedback we're getting from Geneva Plaza residents is they like having the access off of Broadway as opposed to Santa Monica.
And if you think of the volume of traffic coming southbound on 21st Street, because again, a lot of the traffic from the hospital and the health center does go south on 21st, so it's a very heavily traveled street. In the,
I'm not saying this isn't a good idea. If you're only going to put one light in at 21st, I don't know how you're going to do it. It's a nightmare. It starts at 2 o'clock and it goes to 9 o'clock at night. We can't get out.
well, actually, let me just volunteer one additional thought. Currently on southbound, going to southbound on 21st Street, you can make a right turn very easily. It's very difficult to make a left-hand turn because all you have is a stop sign. So in this scheme, when you come north on 21st, on the new northbound 21st, and you come across on St. John Way, you have a choice of going north to Santa Monica or south to Broadway. Both those intersections have traffic lights. So it's a much safer intersection to make a left-hand turn if you're going southbound towards Broadway.
But to get access to Geneva Plaza, you have to do it off of Broadway.
That's
the way
correct.
to get access.
That's correct. Well, right now, the only access is from Santa Monica Boulevard.
And it's not, I mean, there's no underground parking structure on Geneva Plaza. It's for senior housing. It's only surface lot at the back. It's not, many of those people are not driving. It's not a huge amount of parking there. And what it's actually doing is giving, right now they find it very difficult to park along the street. And that will, right now it's very difficult, but in the future you'll be able to park here. You can drive in here and out. For those, yeah, for the residents there, for the Geneva Plaza.
I just want to let you know that did you put in a card? Okay. What is your name? You are Ruth Ann, and I have your card here. To have your questions picked up on the videotape, you need to have one of these in your hand. So Zachary will following up. Yeah. Well, you are next. You're in the queue.
Okay, on that.
Wait. We got to make sure it's on the record.
On that calendar that you showed, it looks like you're not really going to even start till the middle of 2017, correct? So
Oh, yes,
18
yes.
months from 2017?
Oh, that's
Like 2019 you're going to start?
further out than that. We can pull that up again.
So we're talking we're not going to even start for at least 4 years.
Yeah, this isn't even, this is a decision from City Council. There's construction drawings and, lots of things before we're even anywhere near there.
So we're looking like, the turn of the century.
It's slow growth.
Can you tell us at least your estimation of that first A? When you get started, if it's 4 or 5 years, how long it'll take?
Yes,
Because that's a big one. The A is the biggest.
I can. For A, this isn't for the visitor housing, but for the underground parking, it's estimated to take 15 months of construction. And then for the completion of the John Wayne Cancer Institute and CFDC, it's estimated to be 25 months. And again, these are conservative estimates, kind of the maximum.
So that's the one that's the building across from Geneva Plaza, correct?
Correct.
That whole side of that side
Correct.
of the street, the west side.
So we anticipate that the building directly across from Geneva Plaza, Child and Family Development Center, will take less than 25 months. But we anticipate that John Wayne Cancer Institute will take the 25-month period because of the nature of the building. It's a research institute, lots of ventilation and that kind of thing.
And there will be parking for them, right?
Yes, everything has underground parking.
And when you're doing that second part of the A, where you're putting in that 30 family, that one.
Correct.
Is there going to be parking for
10
them too?
families.
Yes, there will be underground parking for
There?
that.
There's
Yes.
gonna be
Yes. Yeah.
We're making sure that those residents have their own parking, so they don't take any street parking, anything like that. They'll have assigned parking spaces.
And again, I hate to ask this, but I asked you at that last meeting because I only know stories.
Yeah.
Our building is 8 stories.
Correct.
Are any of these buildings going to be higher than us?
No.
Thank you. Every time I move, somebody builds something, and we lose all the sun and the breeze. And one more question about that plaza.
On
What
the South
kind of-
Campus.
What kind of? I know they have security and
These
everything, but honestly, I see this open space as becoming a place for the homeless. And I'm not trying to be negative, but that's what happens. You get a nice open space,
Yeah.
like the mall, and they move in.
So one of my other hats at the hospital is I'm the director over security. And I can tell you from that experience that we have open space bordering Arizona and 23rd Street, our healing garden. And even though it's open space, it's monitored. We make sure that we have security officers patrolling that area. It's right next to our emergency department, and we have homeless patients that do get discharged from our ER. And so it's a monitored space. We want to make sure it's open for the community, that they feel engaged and they can use it, but at the same time we'll make sure that it's a protected space.
Yeah, especially at evenings, like after it gets dark.
Correct.
Out come the blankets and everybody
No,
finds
yeah.
little spots.
The hospital is well equipped to kind of monitor and patrol those areas.
Thank you.
Thank you. We have a request to speak from Madeline Geidzik.
We have to swap out the mics. Just 1 second. All right. Madeline?
Why is there a landscape buffer needed on Broadway? As nice as it looks, doesn't it create a barrier between Broadway and the South Campus?
We don't really see it as a barrier. First of all, as I think Lindsay or James mentioned before, the development agreement does require a minimum of 35% of open space on the South Campus. So we've been trying to be very thoughtful in how that space could be organized, where it's located, so that there is some program and functional use of that space. So for example, to the south along Broadway, this is more of the residential and community program zone of the campus. And so the logic here is that the residents, either the visitors in short-term housing or the residents of the multifamily housing, or even the Geneva Plaza, have greater proximity and access to some of those open spaces and gardens.
The city doesn't count roads as open space, but the 2 roads that we put in on the site itself, that's actually it's not used as open space, but we're giving up that space, and you could count it as open space. It's not used as open space, but it reduces the amount of building that's built. So, for instance, this road on both sides, instead of building right up here, we pull the buildings back. We don't count it as open space because the city doesn't count streets as open space, but we have a little bit more than 35%, but if you count that in, it's way higher.
I have one more question.
Sure, go ahead.
Okay. Will there be any critically ill patients at John Wayne? Will ambulances go onto the South Campus and pick up those patients if there's an emergency?
Looking at me.
That's you.
So it's like any other medical office building. You have those unforeseen circumstances where an ambulance is needed, much like an apartment complex or any building in the city. You would have those random occurrences where an ambulance is needed, but no, it's not patients that are critical, like in an ICU or an ER environment.
If I could just add, the John Wayne is strictly focused on research. So our clinical work is, with the exception of maybe what Lindsay's describing, all of our patients will be at the hospital.
Thank you. And we have one more card from Carol, I want to say Sevilla, regarding 2C. Where are you, Carol? There you are. Just get you a mic.
Excuse me.
Is it Sevilla or Sevilla?
It's both.
Go ahead.
So, Mr. Lowe, regarding 2C, if you don't succeed in getting the 96 feet, which is a possibility despite what all your experts are saying here, for the same reason that this gentleman mentioned, it's the number one battle in Santa Monica. We all know it, height restrictions. How does the rest of this, will you have adequate ambulatory care in the overall scheme, and will the bridge still work, by the way, on the third floor?
That's why I pay these architects to answer that question. So hang on.
You're saying if we go down?
Just assume for the purpose of this question that you don't succeed in getting 96 feet despite what your lawyer says.
Does the building still work?
Not will the building still work, will the whole scheme still work in terms of adequate ambulatory
Yes, our
care
building,
and the flow of the traffic
Yeah,
on
if we
that
have to go
bridge?
down another floor, the bridge still works. The bridge is at the third floor. The bridge is way up high. It's up 30 feet anyway. If it had to go down another floor, it still would work.
And you feel there'll be enough space for your ambulatory care without a floor or two?
Yes, I mean, of course we want, what we have there. That this is the program that we have, but the bridge would work, and.
Yeah, and I think one of the steps that our team took was to talk to specific clinicians that really do need to expand their outpatient services or bring them closer to the hospital. So that's kind of why the building height has been designed the way it is. But there's always room for flexibility if needed.
Yeah.
I think those are the request to speak cards that we have. So if we could get the lights up, I invite you all to stay and get to know our team of consultants and have a look at the boards over there on the walls. We've changed them so you can see more specific concepts on those boards. But I want to thank everyone for coming out this evening, and have a pleasant evening. Have a snack, and thanks again for coming.